Now I would like to request Dr. Mohan Leslie sir from Baby Memorial Hospital, Kozhikode, to share few words.
Yeah, we started for the QA accreditation in January, and Dr. Pradeep, who was former president of Indian Stroke Association, he was instrumental in initiating the discussions on behalf of Indian Stroke Association. And as he is in our department here, he took the initiative, and we started the process in January. We went through the standards, and we had most of the systems in place, but what we needed to do was to get a lot of things aligned with the standards. That took some time, and it needs to be presented in a certain way. You need certain statistics collected about each type of procedure, how much complications are there, and how is your outcome, and what. And there's an extensive list of parameters, indicators to be collected and monitored continuously. So that was a bit of a challenge we faced, and collecting that in an ongoing way is now continuing to be kind of something we are still struggling with, because it's around I think 22 indicators are there in addition to the especially if it's in a advanced stroke center. For a primary stroke center, there are only a few. For advanced stroke center, it is, so we try to automate some part of it using software, and that I think is a good approach in such situations. But ultimately, it has to be verified manually, and so some level of can I say human work is required in preparing this on an ongoing basis. Other than that, how it has helped us, it has made us more aware of our deficiencies, especially in terms of when we ongoing monitoring. I think that has made the biggest difference. We had this fluctuation in our door to needle time and door to procedure time, which we kind of were aware of, but the more close monitoring of that after the accreditation has brought it into, and we found that some of the issues are really difficult to solve. Some of them are structural, related to the layout of the hospital, how the ED and imaging are in different buildings. So each center has their own unique issues, challenges, the setting you are working in. So we are still in the process of optimizing the whole thing. We're still not able to consistently achieve very good door to needle times because of our shifting problems from the emergency to the. So actually, we are now planning to have imaging closer to the ED, physically restructuring the hospital, which is a huge task, but that is ultimately that will be the one which helps to. So yeah, it's an intricate and ongoing thing. In addition to the academic knowledge which we were just discussing, and all the guidelines by the associations, when you practically implement in your own hospital, this kind of an accreditation will help you be more aware of where you stand, and it's good to have a discourse between centers also, so that we know how each other and give suggestions to each other how to improve the care. Thank you.
And then one more cath lab as well as one more MRI is also coming in 3 months.
Yes.
That's an additional thing we are looking to.
Yes.